The other two genes which are famous nowadays, responsible about some of the tumors, which is the BRCA1 and the BRCA2 tumors. And those are located again in chromosome 17 in different locus. And the BRCA1 is incriminated when it is mutated, of course, for the development of breast and ovarian and colon cancer, and BRCA2 incriminated in the male and female breast cancer, as well as ovarian, pancreatic, and laryngeal cancer. 5 to 10% of breast cancer are familial, and the mutation usually occurring in these genes in about 80% of those familial cases. So that the benefit, the clinical benefit that we can determine if there is a mutation in the BRCA1 and the BRCA2, and we say that those people are more prone to develop malignancy, and we can calculate the risk according to different models. In the USA, they use the jail, Mitchell jail risk factor assessment. It is a computerized program putting different factors, and then they will try to calculate the risk, and accordingly, if the risk is high, some options can be given to the patients with the breast cancer. Exponential. It means that one cell will divide into 2, the 2 into 4, the 4 into 8, and so on. So that it is a exponential way of development and growth. And the growth, some people believe that malignant cells, they are all the time, they are rapidly growing cells more than the normal. In fact, it depends on the type of the tumor. For example, moderately or well-differentiated tumor, their growth probably equal or lesser or more than other parts of the body. And for example, what we know that a rapidly growth tissue is the bone marrow. Probably the bone marrow growth is more rapid than many of the tumors. Okay? For this reason, for example, another example, one of the fastest growing tissue is the fetus. You know that it starts 9 months ago as one single cell, and after 9 months, it gives a baby of 3.5 kilograms and a placenta of 250 or half kilograms. So that this is the most rapidly growing tissue. Initially, as we said, that when the number of cells is small, the growth is said to be exponential. With time, that there is slowing in the curve of the growth. Okay, and this is due to several factors. For example, if at the beginning of proliferation of cells, we say that most of the tumor is on growth fraction. Most of the cells are on growth fraction. But when we go with time, there is a slowing of the curve, probably due that the rate of growth is the same, but the rate of this is more due to lack of blood supply, nutritional supply, pressure from the surrounding tissue. One of the things that it is important that the relation between the malignant cells and the growth hormones. We know that the growth hormones are present in the body, but when we have a malignant cells, they not only depend on the body, but when they start to have their own growth factors. And this on the slide, there is a test. If we put a cell, it is not here, is it? Here. Can you close this? And we put different growth hormones. This cell starts to proliferate, okay? And this is due to the effect of these hormones like platelet-derived growth hormone, insulin growth hormone, and other hormones. So that those cells, they try to proliferate. What we see in real life that the malignant cells also they secrete their own hormones. And those hormones, as you know, they work on the same cell so that it has an autocrine effect, or it works on surrounding or neighbor cells say that this is a paracrine effect. And you know that the hormones coming from distant parts to work on the tissue have an endocrine effect. But mainly the tumor having the capability to secrete these hormones and to use this hormone in order to grow and to proliferate. I mentioned to you that malignancy can be defined by unhealed wound. We mean that it is unable to heal. If we have, for example, in the stomach, we have peptic ulcer disease or we have cancerous ulcer. In the peptic ulcer disease, once we diagnose this and we apply treatment, usually there is healing. And after healing of the epithelium, there is a contact inhibition and the stop of the proliferation. But if we have the ulcer is a malignant ulcer, if we give the triple treatment, the ulcer will not heal. Okay? For example, and why is that? Because it is a continuous proliferation. One of the growth factors, which is the tumor growth factor alpha, and this will induced by the malignant cells of the stomach and circulate in the same area in order to give an effect to the neighboring structure, so that it will be an endless process unless you get rid from the whole area by doing sort of surgery. Also, it's very important to know that malignant tumors, they don't occur overnight. It takes time. And this time probably variable from one type of malignancy to another type of malignancy. Even in the same type of malignancy, there is a growth variation according to how mature the cells are, how behave like normal cells. So that if we assume that we have a tumor, and this tumor originating from one cell, okay, in order to be 10 to power 9 cells, which is a clinically detectable cell, tumor, 10 to power 9, the number of cells, and this usually occurring in 1 gram of tissue or in 1 cubic centimeter volume, so that this is amenable to be detected either by radiological means or if it is on the surface of the body, like in the breast or in the skin, it can be felt and seen. So that it takes almost 3 to 4 years for a tumor to reach 1 centimeter in diameter or 1 gram of tissue. And this requires what is called doubling time, okay? It needs 30 doubling times to reach 1 centimeter, okay? Yani the cells need to proliferate 30 times in order for 1 cell to be 1 gram of tissue. And this is called tumor doubling time. In order to have 1 million cell, it needs a 20 doubling time. So that 1 million cell, it is a 1 millimeter tumor. But it is, in the real sense, it is those 1 million cell, some of them at this stage are able to migrate from their side to go to other sides. Okay? So that sometimes we find that a very small tumor, when it is of aggressive type, it sends metastasis elsewhere. So actually we don't know whether that we have this tumor proliferating for 3 to 5 years and having 30 doubling time and containing 1 billion cell, whether it is an advanced or early cancer. In our clinical practice, we say that this is an early cancer, but in the term of biology, it is not really an early cancer, it is an advanced type of cancer. So that now, if we have a solid tumor, okay, we remove a solid tumor and send it to the histopathology to have detailed analysis. What we find in this tumor? We find almost 40 or 50% of this tumor mass is not a tumor. It is other supportive structures needed for the cells to survive. So that this applies logistics for the malignant cells. It means that there may be blood vessels, lymphatics, some of the normal cells, fibroblasts, and those are collectively present within the structure of the tumor. And probably the 50 or 60% of the main bulk is a pure malignant cells. And even those malignant cells, they are in different situations in terms of growth and proliferation. Some of them, they are in G0, okay? They are quiescent cells, as similar to the basal cell layer in the epithelium, in the intestine, or the stem cells which are present in the bone marrow. And those are not in the proliferating situation. And we have what is called the growth or the growing cells. And those growing cells collectively making what is called a growth fraction. And this growth fraction is the most important target for chemotherapy and radiotherapy, because the chemotherapy and the radiotherapy targeting the cells in proliferating phase, okay, not static cells. Probably the radiotherapy will be damaged by cells in G0, but mainly the chemotherapy working, the majority of them working on cells who are proliferating. What is the clinical advantage? Before saying that, the clinical advantage, as we said, that we have what's called chronogenic cells or stem cells, and those are interchangeable with the growth fraction. If there is loss in the growth fraction, those will be called to replicate. Exactly, for example, if a person have bleeding, when there is a bleeding, significant bleeding, the bone marrow will be stimulated to proliferate in order to supply what is lost. And there is a myth, it is not a myth, social notion. Many people say that don't touch the tumor because the tumor will flare after touching this tumor. So that many lay people saying don't leave the dog sleeping, don't do anything to make the cells to proliferate. Actually, this is true, and we use this in our treatment, what is called recruitment of cells. Okay, we have one of the topics in surgical oncology called tumor cytoreduction, so that we remove part of the tumor. So what we do by doing this, we will stimulate the chronogenic cells to proliferate, so that they will be in the target of chemotherapy. There is a very typical example about this, which is a Burkitt lymphoma. In this type of lymphoma, when you go and remove this tumor and leaving remnants of this tumor inside the body, within 6 weeks' time, probably the tumor will grow. If you don't apply any treatment, the tumor will grow to its original size within 6 weeks. Okay? So that we can, this is explaining the social notion that don't touch the tumor. Sometimes it is true, and sometimes we use this in case of cytoreduction in order to remove bulk of the tumor to make the remaining tumor sensitive to the chemotherapy. So that